Thank you all for joining us today. I'm Sally with Mesa Chamber of Commerce, and I don't even know how many of these calls we've had every 2 weeks since COVID hit. So I don't know, what is that? Like a dozen maybe, something like that. Anyway, it's good to see everyone. I didn't get the pink shirt memo. It looks like the guys got that today. It's good to have you all here. I think before we get into the meat of things, we should maybe just make some introductions because I see we have a few new faces on this call. So if you don't mind, I'm just going to start and we'll just circle around the Zoom as I see it. So if you could unmute and just maybe say your name and where you're from, and we're going to start to my right, which would be Peggy Lawson.
Peggy Lawson from the Market Builder.
Scott.
Scott Coleman, Mexican, a New Leaf.
Melissa.
Melissa Forrester with United Food Bank.
Carol. Carol.
Oh, Carol Lawless with Oakwood Creative Care.
Great. Jenny.
Jenny Hildebrand with Grace United Methodist Church.
Thank you. Keith.
Keith Lawson with the Market Builder.
Mark.
Mark Young, Mesa United Way.
TJ.
TJ Rant with Mutual of America.
David.
Richards, me?
I'm saving you.
Oh. You're saving me
David?
for myself most days.
David Hughes with manager at East Valley Men's Center.
Thank you. William.
William Carey from yourcharityauction.com.
Great. Erica.
Hi, Erica Emmons with Cigna.
Thank you. Kristen.
Kristen Harvey with Jewish Family and Children's Service.
All right. And here's one of our newbies, Javier.
Thank you. Hi, Javier Olivares from pastor at Grace United Methodist Church. And I was worried at the beginning when I went in the meeting because I thought, oh, I thought I didn't know I had to wear pink, you know, because some of you are wearing pink. So I was afraid that, oh no, maybe this is a group where there's a uniform or something. So but now
just take your shirt off.
Nice.
Anyway,
Linda.
Glad to be here. Glad to be here.
Thanks.
Hello, Linda Haskell, Director of Membership Services, Mesa Chamber of Commerce.
Thank you, Nicole.
Hi, Nicole Magnin with Acronis SES and Acronis SES Vets.
Thanks for being here. Lisa.
Lisa Randall, Family Promise of Greater Phoenix.
Abby.
Hi, Abby Schroeder from Senator Martha McSally's official congressional office.
Thank you, Lauren.
Hello, Lauren Leverett with Gateway Bank.
Mark.
Mark Stasi with House of Refuge.
Paul.
Hi, Paul Johnson with Boys and Girls Clubs of Arizona for a program AZ Youth Force.
Thanks for being here. Denise.
Hello.
Denise.
Can you introduce yourself?
My name.
Denise, do you want to introduce yourself?
Hi, I'm Denise Carter with Overflow Missions.
Thank you. Joe.
Hi, Joe Tansel with Paz de Cristo.
Thank you. Christy.
Hi, I'm Christy with Eagle Pathway.
Great. Scott.
Good afternoon, Scott Seeley, working with Impact AZ, a coalition of nonprofits in Mesa and beyond.
Awesome. Thanks, Scott. Bob.
Bob Nelson, Mesa Chamber of Commerce.
Great. I'll turn it over to Mr. Dave Richens now.
I am Dave Richards, President CEO of United Food Bank.
All right. Thanks. Hey, before Dave gets started, Abby, can you give us maybe an update what's going on with the senator and with your office?
Abby, I have a quick question for you. You said you were with the official Martha McSally official Senate office? Is there an unofficial Senate office that we should be aware of?
Some people get confused between the official Senate office and the campaign.
Got
So
it. Okay.
yeah.
It's
So
not
that's-
like a speakeasy in the back of the office. You knock 3 times and do a twist and you get in, kind of thing. Okay, just checking.
Well, we are right next to the Gladly, so we might be able to make that a reality.
Oh,
So
there you go. There you go. Little tenant improvement in your future.
yeah.
All right, take it away.
So I actually I had 5 quick things and then things.
Awesome.
So I have 6 quick things. So some things you guys might be interested in. She just signed on to improving PPP loan forgiveness for small businesses. She also a while back had co-sponsored some legislation for the National Suicide Hotline number to be a 988 number, similar to the 911 number. And the FCC actually just unanimously voted that into existence. So that's exciting. She introduced legislation to help ramp up COVID-19 testing for senior care facilities to hopefully get more money and more metrics around that coming soon. And then expanding access to affordable COVID-19 testing, since we were hearing a lot of problems within insurances going around through different loopholes and not covering antibody testing or different kinds of testing. So she's working on some legislation there to hopefully close that up. And she actually is also working with Senator Sinema to reauthorize and increase Native American diabetes program funding, since diabetes has been proven to be both very prevalent within the Native American community as well as very deadly comorbidity for COVID-19. And then the last thing, she's also helped introduce legislation around telehealth services being improved, as well as medical monitoring, since that's a huge issue right now for both rural communities and just older folks who can't quite get to the doctor's office as much, or in family homes where the younger people in the home also help provide medical advice to their elderly parents if they don't want to go to the doctor or things like that. So while she just flew back out to DC finishing up recess, it's been a busy couple weeks since we last talked. So I have tons more information about all of those things. So I have my email in the chat if any of you guys want the press releases for those, the legislation details and things like that. More than happy to send over whatever you guys want to see.
Hey, Abby, it looks like Mark from United Way put a comment in about needing to speed up test results. Is she working on that at all with anyone?
So as far as test results, they're currently still going through the next stimulus package funding. They just got through the NDAA funding package. So coronavirus is the next thing. So I think there's talks within funds to help increase lab capacity, which is one of the biggest things stalling wait times, right? Is just helping that get. So
thank you.
Whoever asked me about that, shoot me an email about that, and when things pop up, I'll make sure to keep you in the loop.
Awesome, thank you. All right, Dave, all yours.
Okay, Sally, if you'll let me share screen.
Yes. No.
Bob, if you could let me share screen.
Yeah, it's not an option on it for some reason.
Enable screen sharing at all?
No. There. Do you see it, Bob?
You have to make him the host.
The host has to enable screen sharing.
I'm looking. Hang on.
Oh, there it is. It popped up.
Got it? All right.
Okay.
Have it?
All right, here we go. So I'm trying to share. Does anybody see a Mesa Care slide yet?
No.
No.
It might take a minute to propagate out. So.
Nope, I got it. I got it.
There we go.
I think.
Yeah.
All right, you see it now?
Yep.
Oh, we did.
Okay.
And some emails.
Oh. Let's see.
There you go.
There you go. I switched the wrong screen. Okay. So it doesn't show it on mine, so I don't know what you guys are seeing. So
The help yourself numbers.
Okay, good. All right, so this gives you a pretty good overview of what our distribution numbers have looked like and what our trends are looking like right now. And so here again in March, just a point of reference, this is pre-COVID distribution. The 1187 in March was the first distribution when the pandemic started, and then we moved to the Mesa Convention Center on the 27th of March. Saw some pretty high numbers for a month or so, dropped down, instituted the Mesa Cares program there, had big numbers again, and then we stayed pretty steady. This drop here, the 3rd of July, we went back to once a week. So from about Mesa Cares to the week with 1977, we were distributing on Wednesday and Friday. Then when we dropped to once a week, we actually haven't dropped to once a week. We're doing a once a week distribution in partnership with Wells Fargo at the branch location at University and Gilbert Road. And so we instituted that. The first distribution then was this one for 1533. If you add about 200 to that one, and then to the July 17th, we did 300 families at that Wells Fargo at 6 p.m. Every Wednesday night till the end of August. And so that, if you add that number in, we've been pretty steady along this same number as what you've seen since late May. Good news is, I think that we're starting to see unemployment numbers go down for the state of Arizona. That's very encouraging. I was going to show you guys this here. These are a little bit more details digging into the distributions where you see the number of pounds distributed, the number of households, numbers of individuals in those households, you know, how many pounds per household that people are seeing, and a little bit of notes in the detail. So been pretty steady, mostly Mesa addresses we're seeing at those distributions. So I am now going to stop the screen share. And so even though the unemployment numbers are encouraging, there's a bit of a cliff on the horizon that I'm sure we're all aware of with the cessation of the bonus unemployment payments of about $600 a week to anybody receiving unemployment assistance. And also you had the ending of the eviction moratorium. But that's been put off now till October 31st due to Governor Ducey's order. So hopefully that will keep housing stable for most people. Again, just because you have a stay from eviction doesn't mean that if you can't pay your rent, you're not accruing a debt. And so for those agencies that do rental assistance, you'll need to keep in mind that's been a very clunky program due to the requirements that people have had to fulfill. It just takes a lot of paperwork. And if you have a hard time doing your taxes, you're going to have an even worse time doing rental assistance. Looking at some of the requirements, I was a little appalled. I would prefer if I was advocating for changes in that program, I would put the rental assistance on the landlord rather than the tenant. And that if the landlord wants to preserve their tenant in that place, that they will work alongside that tenant to get the money they need to help them pay their rent. You know, put the financial incentive where it belongs. With some professional capacity in the rental companies. But, you know, I don't know how many tenants are helping, but it's been left to mostly nonprofits to navigate that. And it's been very clunky and cumbersome to see people take advantage of that program. Hopefully that's starting to pick up steam a little bit, and we'll be able to see some tenant assistance so we don't face another cliff in October on the rental assistance front. I know several of you are doing utility assistance, and some of the utilities have been helpful in that space. When we do our round robin, I'd love to hear a little bit more about that for any of you that are working in that space. So we're, you know, steady as she goes as far as it looks like the numbers are starting to drop in Arizona due to some of the mitigations that are taken. That's still pretty prevalent, but we'll see where that trend continues over the next couple of weeks. So I don't foresee any big changes in our food distribution, but I'm looking forward to hearing from you guys. We thought we'd spend more time listening today to the people on the call than doing a big presentation. Usually we have some kind of a guest speaker or somebody sharing some key information. But today we wanted to give more time to you to network, to interact on what you guys are seeing. And so, Sally, how did you want to go about it? Do you want people to just jump in, or should we call out a few folks? Maybe start with Mark Young at Mesa United Way. Always has some good things going there. Just to kind of prime the pump a little bit, Mark, if that would be okay. And then we'll kind of go from there. Is that okay, Sally?
Yeah, sounds good.
Okay. All right, Mark. Thank you.
Certainly are seeing a rise in at least people being homeless. We get quite a few calls about people who are getting evicted. We've taken care of some of those rents. Some of them are just outlandish. I mean, we had a call the other day for one, it was $2,800, and that was 1 month of rent. So wasn't much we could do about that. We are working with the city. The city has grabbed 100 hotel rooms across the city, primarily in two hotels, but and they have those rooms through the end of December. So we're paying for those rooms. Like United Ways, we pay for 10 at the day's end. We're using 2 of those for aging out foster kids, 2 of those for vets, and then the others we're using for people that are just as a stopgap between getting the services that they need to get back into housing. So we have some dollars also. However, I'm holding on to that, to be really honest with you. I'm concerned that 3 months from now, 4 months from now, maybe there's a vaccine, maybe we're back rolling, but the people who lost their jobs and who are 2 or 3 months behind in rent are going to be in some serious trouble. So I'm afraid that we're spending a lot of the money, especially dollars that have come in from foundations. A lot of those dollars came in up front. I think people have gone through those up front, and 6 months from now, I'm concerned about what that's going to look like. I'd love to be super wrong, but that's kind of what we're doing. We're continuing, work at the vet center, although we've had some touch of the COVID there. We've had some touch of that in our office. We're continuing to do our VITA work. We're continuing to do work at Helen's, although we've had a little touch of COVID at Helen's. So, we're doing the best we can. I have some pretty strict rules about that, but we're working at it. I think it's probably also, in staff meeting today, I said, we need to find new ways to function. At least this is our new normal from now through December, unless we have some kind of magic wand thing that happens. But as we look about how we're going to do what we're doing now through innovation, I'd like us to look for innovation that we can hold on to once we're back to normal. So, one of the ways that we're doing that, I think, is that we're bringing in AmeriCorps to take photographs of all of our clothing in Helen's Hope Chest. People can then shop for that across the state, choose the stuff that they want like they would on Amazon, and we'll ship it to them for free. Because what we were going to do was load up the van every weekend and take it to another community and do it that way. That's not going to happen. So we're trying to look for innovative ways to do what we're doing that will hold after we get past this thing. So that's kind of where we are, Dave. Thanks.
Thank you, Mark. I like that frame, Mark, about thinking about innovation that we apply here and into the future. We've been thinking a lot about that on our food distribution, knowing that at Javelina, where we typically do that program, we can't do touchless drive-through distribution. And, really trying to figure out how to address that issue when we get back to pre-pandemic numbers, if that ever occurs in the next, few years. But, okay, who's up next? David, you want to hop in?
Thanks, Dave. Yeah, at the East Valley Men's Center, water and food is doing well. We really appreciate the waste not meals that come in. They come in handy when some of our volunteer groups can't make it. Most of them have been dropping off food or just making financial donations. So those have really come in handy. We had a touch of the COVID, so they began doing resident-wide testing. And then we're going to start doing some staff testing. I don't know when that's going to start, but so with that, for about 2 weeks we were suspended on any new intakes until we waited for Maricopa to make sure we had all our protocols in place and we were doing everything, which we have been. I mean, we held out for a long time without anything showing up, and so we're doing everything right. And then once they just said, okay, we can start doing intakes again, we're trying to slowly get that in. We don't want to rush it, but we want to prioritize. You know, we got a lot of people looking for space and trying to get off the street, the street population. So we're working at it. You know, still, we get a lot of guys. You know, I'd say probably we had about 30 guys so far that decline testing, refuse testing. We think it's just because they might be afraid that they're going to lose their jobs if they have to go into isolation, and they've worked so hard to get where they're at, and so they're afraid to get that. So we're trying to encourage them to do that, so we know where we stand as far as any positives that we might have. But yeah, so we're still grinding at it, still chugging away. Mark?
I just wanted to say to Abby, part of the reason why the test results are so important is that, you know, I've had people at the vet center and in our office and in Helen's who have been exposed, and our structure is until they are tested and get results back, they can't go back to work. So when you have a small shop, and now I can't have anybody work, it's open, shut, open, shut, open, shut, because we're waiting anywhere from 10 to 14 days to get results for people. So it has a pretty tremendous impact on us economically about what we can do to serve and what we can do to raise money, when by the time you get test results, you're probably over the virus if you had it in the first place. So thank you, sorry.
Yeah, absolutely. And we've been hearing that I think the wait times in some areas to get test backs are up to 2 weeks now, and that's just ridiculous. So yeah, I'll definitely keep you in the loop for what she's doing on that.
Unless you can afford to pay $125, you can get those results that day, but it's just one more vision. It's one more place of disparity between the rich and the poor.
Absolutely. I will say, I know that the ASU saliva testing that's recently been happening, their turnaround is actually 48 hours. So they, I think, just had one today, or Saturday's also coming up on the Arizona Department of Health website. They have more information, but that one is free. You don't have to have your insurance at all. You just you make the appointment online, you drive up, you spit in the tube, they scan your appointment barcode, and then they scan your tube, and then you can check online on your portal, and in 48 hours, so far, it's been coming back because ASU is in control of the labs, so it's less turnaround time rather than having to ship it all around the state and figure it out. So just a little nugget of knowledge for you.
I have to run real quick, but can I give an update on Oakwood?
Please, thank you.
So we have opened up our phase 1. So working with those most vulnerable people, our members, we are sad to say that we have lost a good chunk, not necessarily to COVID, but from lack of engagement. So their brains aren't functioning and they're really spiraling down. We've also had a number of families who are at this point can't handle having their Alzheimer's care members at home and work and educate their kids, so they are placing them in long-term care facilities, which is really sad when you realize that 65% of the deaths have come from those. So they were begging us to reopen, and we're working with an infectious disease person who has donated time to us. And so we have 6 people coming for 4 hours daily, and we are looking at going to phase 2 because there is a list of newer people who also want to join in, but we haven't been taking new people just to protect the members that we have and whatnot. So we've been very innovative. We've really pivoted. We've been offering Facebook Live exercise classes, Zoom classes, and trying to engage with our members where they are. Very difficult when the caregiver is possibly also of the same age and they're not technologically savvy. Also, a lot of our seniors don't have computers with a camera, so that interaction doesn't happen. We also have the situation where the caregivers are not getting respite. So if you have someone that shadows or whatnot, it is nonstop. So anyhow, we're excited because we are seeing a lot of the people are coming back because they are getting the engagement that they need, that their members are just really happy. So I'm really impressed with Sherry and her leadership and what Oakwood is doing. So yeah, that's pretty much my update.
Thanks, Carol. It's been fun to watch the transformation that's happened at Oakwood over the last, I don't know, almost a decade, really, maybe 7, 8 years. I was on city council when she kind of came on board and had the vision to transform the way that they did service delivery there, and the name change and the remodeling and all the things that have happened there have been really great. And having had several friends that utilize that service and hear them rave about how much of a difference it made in their lives, just kudos to Oakwood and all the great work that they've been doing.
Thanks.
Very good. All right, who's up next? Scott, you want to hop in?
Hello, everyone. We are catching up on the ADO webpage, trying to get those rental requests, eviction prevention caught up. I just posted the form that you can use online to request utilities. It's interactive sort of as you progress through the form, and we will get that via email and process it once it gets to the office. So we're progressing. You know, we're trying to get everyone's taken care of. We've seen a lot of people, even though they've been getting the unemployment, have not been paying their utility or their rent. They are expecting either the funds from ADO, other utility or other rental assistance, or utility people giving utility assistance to pay for those. It's been, we've seen bills larger than $1,000.
Very good. Thanks for that, posting that link for the utility assistance. You know, Sally is, as I know, we email reminders, and you guys have those links. If you could capture some of those links and make sure they get incorporated in some of your updates to see if we can't get them broadcast a little farther and wider, that would be great. Who else on the line would like to jump in? Javier, Jenny, Joe?
I'll let Javier speak. I choose you, Javier.
Javier, I guess you're on the clock now.
Thank you, Jenny. Well, I just got here, you know, July 1st, and so been trying to learn, you know, all the dynamics of the church, and the community is difficult right now because, you know, we haven't been able to worship in place, and I don't know how long, you know, that's going to continue. We are recording from the sanctuary, just a few of us, and but I'm just, you know, trying to get the feel and learn, you know, what the needs are. And Jenny has been very helpful, and we're trying to get some families, invite some families to the food bank that they have at Wells Fargo. I think it's through United, or I'm not sure. Yeah. So I don't know, Jenny, if you want to add something else. I'm sorry, I don't. have anything
I kind of
else.
put him on the spot, didn't I? I'm sorry.
That's okay. That's all right.
But yeah, the church is continuing to do as much work as they can, considering the restrictions that are put on, not only by the pandemic, but by our own denomination. So we are working on trying to think like you have been doing, Mark, think about if we're going to add a virtual worship experience for our congregation going forward past the pandemic. We have had a lot of positive feedback about that, especially for our older members that do have technology and are appreciating that worship service for themselves and their families. The other thing that we're working on is helping our ministry that we do at Reed Park. We're working to get approval to distribute some gift cards to the families so that they can buy whatever resources or purchase or pay whatever resources they need for their children to get back to school. One of the things that we've learned is that not all of the families, and you've heard this on the news, have access to Wi-Fi and internet. And we're working with one of the schools to see if they can tell us whether Cox is going to continue the discounted service for low-income families to allow their children to continue in virtual school. There's a lot of question about whether they're going to continue that way or if they're going to come back in person. That decision hasn't been made yet, but our families are
Jenny, I think also Pastor Wade is doing at, I think he's at Mount Calvary Baptist there across, not far from Reed Park. I think he's been doing some the Farmers to Family food box distribution. I'm not exactly sure when he's doing those distributions. I thought it was Thursdays. He's had a little difficulty in kind of getting that going, but I just want to throw that out. If you guys are doing anything at Reed Park, he might be somebody worth reaching out to. And I guess he's got some access to those Farmers to Families boxes. He had a truckload last week that he couldn't get rid of, so he called us, and we, of course, took care of it. So everybody's a food bank right now with those Farmers to Family food boxes. They're great. That's what we're giving away at Wells Fargo. The product that we're getting in those is absolutely amazing. Just lots of fresh produce, some dairy, a gallon of milk, sour cream, cheese, butter, great stuff. This week at Wells Fargo, we're adding a meat box with a couple varieties of pre-cooked chicken. So we're excited to add that. So people coming to that Wells Fargo distribution are going to get quite a bit of food. We're only bringing enough for 400 families at that distribution. We served 300 families in an hour and 12 minutes last Wednesday. So it's going to go very quickly. I anticipate we'll do 400 families in about an hour and 27 minutes. So I'll see how close I get. So, all right. Thank you, Javier and Jenny. Joe, have you chimed in yet over at Positive Crystal? You settled in to Arlen's shoes over there yet?
Yeah, thanks, Dave. Yep, I've been flying on my own for 8 days now. So, yeah, I miss Arlen, but I'm glad to be here. Paz has been busy. We're serving roughly 150 people every night coming to the door for a hot meal. There is plenty of food in the food chain, and so we are giving our guests a nice hot meal with a to-go bag every evening. In addition, we did start up our shower program again several weeks ago now. So it's probably been in place for at least a month. And that is something that we had stopped. We had suspended that due to the concerns with the virus, but we've taken extra precautions and we're fully disinfecting and sanitizing between each shower, and about 40 people per Wednesday. We run our shower program on Wednesday, show up and they get a nice hot shower with a clean t-shirt, underwear, and socks to go. So that's something that the guests really appreciate, and it was desperately missed there for a while. The only thing also a change that we have made is that we are offering all our guests a face mask, a face covering, if they show up and they don't have one. We're asking them if they would like one. So we've actually been going through the supply that we had. And I made a request of Maricopa County government, public health. They had a solicitation out, and I made a request for 500 masks, but I haven't received those. So I didn't know if there's any community partners out there that can put me in touch with some cloth coverings.
Hey, Joe, if you literally go visit your neighbor at the old Sunkist factory, his name is Nick, his company is Hotline, he's producing face masks. Go talk to him, because I know he's donated some to Pause. I don't know how long ago that was, but he'll take care of you.
Oh, excellent. Well, thank you, Sally. I haven't met him, so it will be a great opportunity.
Introduce yourself, your neighbors.
Yeah, sure.
He'll take care of you.
Well, we're trying to keep the property clean, and we're moving a little beyond Pause, since we are adding a little bit of trash, I think, in the neighborhood with our to-go. So yeah. I'll make my way over there. Thank you.
Yeah, absolutely.
Joe, I'll look at our inventory. I know we have a fair supply of paper masks, but I know we have a few cloth ones floating around too. So I'll see what we have and send it your way.
Yeah, you know, we're leaning a little more towards the cloth because we believe they'll be a little more durable, and they'll hold on to them a little more than the paper. But thank you.
Okay. Kristen, were you raising your hand? So we have, I think we haven't heard from Kristen or Lisa or Scott or Mark. So anybody that wants to go next, go ahead and chime in.
I'll go. I want to thank Sally, Bob, and Linda for the invitation to be here today. We joined the chamber yesterday. So again, my name is Lisa Randall. I'm with Family Promise of Greater Phoenix. I know many of you here in this Zoom room know who we are, know our Executive Director, Ted Taylor. We are an emergency shelter program for families with children and their pets. We are now in Mesa. Unfortunately, because of COVID, we are not serving families in Mesa. Family Promise is located on the campus of St. Luke Lutheran on Stately, just north of University. And so as soon as congregations return to normal, we don't know when that will be or if it'll ever look the same, we'll go back to our model, which is partnering with the faith community. So over 50 congregations and synagogues valley-wide pre-COVID opened their doors, welcomed our families, fed them dinner, and our families slept there right at the congregation. We picked them up the next morning, brought them back to Family Promise, and our social work team case managed them, helped them get jobs. Families are required to work in our program. And we continue to welcome families into our program and graduate them. We are just doing it differently. We're sheltering them at our Bellevue and New Earl locations. So families are sheltering in places that were not designed to be 24/7. We have also ventured into eviction prevention. So through a partnership with HUMI, Help Us Move In, and Vanguard and another generous donors, we have secured, in our mind, fairly significant funds to join those of you in the community who are working on eviction prevention as well as deposit help. So I'm grateful to be here and to work closely with all of you.
Hey, Melissa, can you give an update on the hydration campaign? You're muted.
Sorry about that. We got great stuff going on. The Mesa Rotary Club, we are meeting with them tomorrow. They've raised enough funds to donate 11 pallets of water, which is great. Thank you. The Keller Williams Keller Class team donated a total of 97,920 bottles. Wow, they did an awesome job. And our friends at Eastmark did, where did Eastmark go? Eastmark also did about 30, I think it was like 34,000 bottles of water. So that was a new record for them. So I think I already shared that with you guys here in previous meetings. But yeah, some great groups coming up and doing wonderful things. And then 1-ton challenge pallets here and there, which is great. People coming in. So thank you.
That's great.
Kristen, let's go to you next.
Hi, everyone. I'm with Jewish Family and Children's Service East Valley Healthcare Center. We are in Gilbert, right on the corner of Mesa and Gilbert, actually. We just want to let everybody know that we are, open, and we are encouraging anybody who needs to come in for counseling services or primary care services to come in. We have moved to telehealth, so we've been providing a lot of services through telehealth, which is kind of one of those things that we do really like, and we do plan to continue even after all of this, just because it does, provide a way for, families and basically people who need the services but have a lot of barriers to get there. So it's actually been really good, and we've seen a lot fewer cancellations and such with telehealth. But if you can imagine, engaging, a 6-year-old child through telehealth for counseling services, those kinds of things are extremely difficult. So we do, our focus has been to really create an environment where people do feel comfortable coming in, and really creating protocols where, people do feel safe and comfortable coming in, and letting everybody know that we are there and open. So one of the things that we just recently got was the certification through Healthy Verify. If you're not sure what that is, they've partnered with ASU, and they kind of go through and match the individual business and create protocols that you have to go through and show that you're doing these things to prevent infectious disease. So you have to go through all of these things, and then you get the certification. So we recently did that. So we've gone through a lot of things just to kind of make the environment that much more safe for people, and to let people know we are, taking the protocols very seriously, that we are doing, so that people can come in. And if you were to go through Healthy Verify, it would look differently. For a healthcare center, it's going to look differently than for, food bank or another type of business. So that's something we've done recently. So again, we just want people to know that we're there. I know a big piece of this has been people missing out on going to counseling services or getting primary care services because they're worried about going out. Not everybody is comfortable with the telehealth. So we don't want to see, kids missing checkups, or, people who have, ongoing health issues being ignored because they're not getting them checked out because of COVID. Obviously, we need them to be safe, but we don't want people ignoring health issues if they have them either. So again, our primary focus has just been to create an environment where people do feel comfortable coming in, but we are utilizing the telehealth, and that's something we are going to continue. So it just, different things work for different people. So we do have both as an option right now. So I think that's it from us.
Very good, thank you. Who else out there? Scott, Mark, Scott.
Dave, yeah, Scott Seeley checking in. Dave, thank you very much. My big thing, my takeaway so far today is just to be grateful for so much information and insight from people, from hearing about the variety of things that are on the senator's plate as needs that we're all hearing about. That it's good to know she's aware that these are problems and need some help. Also, I wanted to thank from our last time around, and I may have privately chatted with Erica here, so you might watch for that. But Cigna's Healthy Kids program that we heard about last time, and have shared that with a couple organizations that are interested in it. One additional thing, and I'm aware that Maricopa Community Colleges have got a lot, and other people probably have access to this funding too, but SWIFFE funding for specific courses that they're teaching. One of them I know is in the technology area. They have had students who were homeless go through a 6 to 8 week program while they were living in their cars and got their certification and their first job and made their down payment on an apartment in the same week. So if there are folks here that may have candidates, SWIFI being Strengthening Working Families, so parents with children that you think might be good candidates for getting a leg up, or getting a start on the career, specifically in this case technology, but they have some other programs as well. Please send me a note or via Sally or Bob, and love to get you connected with the team at Maricopa Community College that has more detail on the workforce training opportunity.
That's great.
Very good. Thank you, Scott. Anybody else, before we kind of throw it over to some of our corporate partners? I know we have a few of our corporate nonprofit support partners like MBI and APS and Cigna, and I think we have Mutual of America on. Anybody want to jump in? TJ, you want to start? And we'll go over to, I think, Rustin, are you on as well? We'll get an update on APS. I know they don't do a ton in our service territory, but it's good to hear what's happening on a macro level from a utility standpoint.
So what we're doing is just struggling with the work from home. I have to add that point of the importance of getting the test in as quickly as possible. My wife was actually exposed, and she had called in and was told she wouldn't get the test results till Monday, which would have been 16 days after she got tested. So by that time, she's probably most likely already, if she did have it, would be clear of that. One kind of update that I'd like to invite everybody to is August 7th. We're putting together a webinar pertaining to the CARES Act updates. So anybody can email me for an invite or give me a call.
Very good. Rustin, you on still?
Brief.
Rustin?
Thanks, Dave. I'm here, guys. Thank you so much. Another great call. Just quickly from the APS perspective, again, so that everyone's aware, if you're not an APS customer, but you have family or maybe you own a business in APS service territory somewhere in Arizona, we are suspending shutoff of power to customers for non-payment at this time. We're waiving late fees. And of course, we have a customer support fund for customers that are past due or need assistance paying their bills. Those continue. We're also strongly promoting during the summer months our savings tips, notably pre-cooling your home or your business prior to peak hours. We have a number of service plan options and then other assistance programs that are designed to really help folks get through not only the COVID-19 crisis, but general summer month issues that they may have. So we've got crisis bill assistance, 211 for community information and referral sources, veteran groups and community action programs, Project Share, weatherization assistance programs, and then medical support programs, as I've mentioned previously. So lots going on for us, and we're certainly available to help. You can reach out to me with direct questions anytime. And then, of course, our partnerships with all of the nonprofits that we have and new ones will continue. We want to certainly support the efforts of the food banks and the chambers of commerce and many, many other groups, hundreds of nonprofits across Arizona that are doing so much right now. So that's sort of what we're focused on, keeping the lights on, making sure that we're doing our part with wildfire management and containment, working with those other agencies that do that bit, and that's where we are. So stay safe, and thanks for the time.
Thank you, Rustin. Let's see, we haven't heard from Peggy or Keith. Nicole, I see you're still on. We haven't heard from you. Mark, Christy, Denise, any of you want to jump in? Bob, I didn't call your name on purpose.
Mark, what's happening at House of Refuge?
But just last week we did and I realize, David, that you guys do this on a daily basis, but being the only outlet out here in the East Valley with regard to food distribution through City of Mesa and Midwest Food Bank. We hit our 2,000 mark just since starting mid-May. So that was a big, big deal for us last week. And we're averaging about 150, 175 a day now, which is really, really good. So we're hitting the East Valley on that food distribution on Thursday and Friday mornings. And on our, core mission aspect, we continue to transition families, into affordable housing opportunities and transition families into House of Refuge. And we're starting to see a bit more of a trend where those families back in March and April who were experiencing unemployment or underemployment, that's kind of turning around, which is very, very encouraging.
Thanks, Mark. Erica, do you have any updates? Yeah.
Just real quick, thanks for having us last week or 2 weeks ago talk about the Healthier Kids for Our Future. So that program, just as a quick reminder, is a $25 million grant program committed by the Cigna Foundation for improving the health of children. So the first phase was related to programs that supported food insecurity for children, and the second phase now is those programs for food insecurity can still continue to apply for grants. The second phase is adding programs related to mental health and well-being for children into the mix. So I'm not by any means the expert on the Cigna Foundation, but I'm happy to connect anyone who wants to start the grant process and maybe has some questions about criteria or their meeting the qualifications. I can connect you with someone from our civic affairs area who could kind of walk you through and help you out with that. I would love to see it come to more of that $25 million in Arizona. So whatever we can do to get it here.
That's awesome.
Thanks, Erica. We're excited about our project with you guys at Holdeman Elementary. Hopefully that comes together and is able to get funded and able to move forward. We're learning a lot about the project, so you guys have been great to work with so far. All right, we are at 4:53. We have about 7 minutes on our planned hour call. Anybody else want to jump in? Christy, Nicole, William?
Denise?
Sure. Oh, sorry, did I interrupt someone?
No, Nicole, go ahead.
Hi, everyone. So I'm mostly in listen mode right now, and appreciate you guys all telling a little bit more about your experience and what you guys are going through. But just so everyone's aware, I know someone before mentioned telehealth and some of the challenges that have come along with that. Acronis SES is doing a lot of work right now on the cybersecurity side of telehealth. So we'll be having a webinar in mid-August, on that, or bringing in some thought leaders on telehealth, not just on the cybersecurity side, though that will feature as well. So I'll definitely make sure everyone gets the invite in case there's interest in joining on that side. There'll be opportunity for a lot of engagement and Q&A, and would more than welcome anyone to join in and sort of voice some of what you're experiencing on that front. Thanks.
Thank you, Nicole. Denise, I don't think we've heard from you yet. Do you have anything for the group today? You're on mute. If you could unmute your phone. There you go.
Hi. Oh, I don't have anything to say. Thanks for all the good information.
Wonderful. Thanks for being here.
Hey, Dave, William has his hand up.
William.
Do I do this better or just do the little button thing?
You just, with this group, you just have to jump in and start talking.
Well, I'm new to this group. We just help the individual charities and nonprofits make money. For those that are interested in that, we just raised a couple $1,000 for Superstition Food Bank and raised about $10,000 for a a child that was just having cancer, and we just worked with the church, raised a few $1,000s for them. We've got kind of a unique opportunity where we pretty much do all the work for you. And it takes, with the food bank, I worked with their 16-year-old part-time intern, and she put in about an hour's worth of work, and we raised that for them. So if anyone needs to raise specific funds for their organization, feel free to reach out to me and I can show you the details, but it's as close to free money as you can find, besides PPP.
Wonderful, thank you all. Thanks for helping out Superstition Food Bank. They're a great partner. I think they're one of our top 10 agencies by volume at United Food Bank, and they do a lot of great work out there in the Apache Junction area. For those of you that aren't familiar, Apache Junction Food Bank has rebranded as Superstition Food Bank because they serve a much larger footprint than they have in the past. So, Christy, anybody else? We've got about 4 minutes. Sounds like we've covered it for another edition of the Nonprofit Vitality Council. Sally, back to you.
Hey, just real quick, Mark had put a comment in the chat about getting together for some brainstorming on innovation. Maybe just a show of hands if there's other interests, and we could schedule maybe a separate Zoom just to kind of do some chatting and brainstorming about how to move forward. Anybody else interested? Okay, there's enough people that we'll go ahead and we'll maybe look at a day in a week or two and get that scheduled and see if we can't come up with some things that would be fitting for everybody. Anybody else have anything? Anybody have a special idea for a speaker? Linda and I were chatting. I think we've got a couple of ideas. If not, we will get you out of here early, 3 minutes early.
Thanks, everyone. It's great to see you all.
Good to see everybody. Stay well, please.